Today at the National Press Club, a forum on funding the public health system. Michael Moore from the Public Health Association, Rod Wellington from the Rural and Remote Allied Health Sector, and Sheila McHale from the Palmerston Association will discuss federal health funding cuts in today's National Press Club forum.
And today we have a panel of 3 speakers who work in the health sector in the not-for-profit area to speak with us today about health policy in their respective fields. Our panel includes the Honourable Sheila McHale, who today is the CEO of the Palmerston Association in Western Australia, a respected not-for-profit drug and alcohol rehabilitation service, and of course comes to this role with a long history in politics and public service, having served as a Cabinet Minister in Western Australia and on many not-for-profit boards in the West as well.
Well, thanks Rod and Michael, and welcome to you all. As a visitor from Noongar country, I also pay my respects to the Ngunnawal people and acknowledge elders past and present. I am the CEO of Palmerston Association, which is in Western Australia. It is a drug and alcohol service, but today my primary task is to advocate on behalf of the many services throughout this nation who are facing significant funding cuts. I'm quite confident that many of you in this room will know someone who has a mental health issue or who has an alcohol or drug issue. You'll know someone who is needing advice or support. Some of you may have had deeply personal experiences. So think about the collective experience in this room. We've got a fabulous crowd of over 200 people here. Think about that collective experience, and it becomes easier to understand the size of the problem and indeed the cost to our nation of drug and alcohol issues. So we have to ask ourselves, therefore, why are we even having this discussion today? Why then is it that the not-for-profit sector is facing massive cuts? And why is there a need to have a campaign such as the one that is being led so ably by the Public Health Association of Australia? Well, to some extent, the answers lie in the current context in which we're operating, and I'd like to describe how I see that context. The people who need services for drug and alcohol issues have been poorly served by government policy and fiscal decision-making over a number of years. I stress that, over a number of years. We've seen little real leadership or vision, and certainly limited growth in funds to support innovation. On the other hand, we've been involved in, and we've seen both time and therefore money somewhat wasted on reviews and investigations, modelling and remodelling of funding options, which have gone nowhere fast. What is the point of paying for and getting advice when it's not used? To understand why these anticipated cuts make no sense, I'm going to use 3 examples of services that are currently being threatened. But first of all, I want to pare back everything and start with, by way of example, a very personal story, and that of a person who is known to my service, and we'll call her Julie. Julie has been one of Palmerston's residential clients. What brought her to Palmerston was her 5-year addiction to ice. But her trouble with alcohol started way back when at school at the age of 11 she started smoking, at the age of 12 she started drinking, and she took up cannabis at the age of 13. Living in a regional mining town with not much to do, drugs and alcohol gave an answer to the boredom that she and many others felt in small town living. At 18, she found her true love and best friend. No, it wasn't a partner, it was actually amphetamine. At 19, she was pregnant and for a while functioned well. At 24, she found codeine, and at 28, traded codeine for ice after a traumatic event involving her daughter. And this is where her life really fell apart. She lost her home, her possessions, her family. In 2014, her children were taken into care, and she couldn't stand the pain of losing her children So she took more and more drugs until, she says, she had just about forgotten her children. Now, the good news is that Julie is travelling well, that she has responded well. And at the time of her writing her story, she'd been clean and off ice for 7 months. But variations on this story occur thousands of times across Australia, and it's these lives that will be affected by the cuts. These stories are not confined to the young or the unemployed or the stereotyped client. They are the stories of all of us. They are the stories of high-profile politicians, of footballers, of police commissioners, of stellar performers in the corporate boardrooms. They are the stories of families that fall apart. So I'm now going to give just 3 quick examples. My first example comes from Victoria. The Circuit Breaker program, run by Odyssey House, is a small 15-bed therapeutic community that provides short-term rehabilitation. This is an award-winning program. It focuses on people who are rebuilding their well-being and reintegrating into the community. It works. And yet, despite having a waiting list that extends to April 2016, this service will be lost without the flexible funding. Programs such as this should be replicated, not threatened with closure. So my second example is the capacity building of the sector. And one of the strengths of the flexible funding has been the opportunity offered to the sector to build and improve the capacity to support people with both a mental health and a drug and alcohol issue. That is the comorbidity of many of our clients. This has been a really positive outcome of the funding, but again is in jeopardy. It's in jeopardy in part because it's not perceived as frontline services. And yet this capacity building is so vital to that therapeutic relationship with our clients that initiatives funded under the flexible funding cannot be seen as separate from frontline services. This is the program that has enabled continuous and in-depth capacity building of the sector, a sector which has been highly proficient in dealing with alcohol and drug therapies, but traditionally less confident about working with clients with a mental health problem. We know that around 75% of our clients may have a mental health problem. We know that those with a serious addiction to ice are likely to exhibit mental health issues, and we need to respond to their realities. So initiatives such as training in mental state examination, support for cultural capacity building, practice principles around dual diagnosis, and partnership development across the services have all been strengthened by the flexible funding. And one service has described the impact of the flexible funding in the following terms. The co-occurrence of mental health with alcohol and other drugs is well established, and the fund has contributed immensely to developing our capacity to respond in situations where working with comorbidity is the norm, not the exception. The resources provided by the fund also provide capacity to keep that momentum going in an area of work which is both complex and challenging. And here in the ACT, clients of Carolica have benefited as a result of the capacity building of that organisation. So my final example reflects the particular impact of these cuts on Aboriginal control services. The threatened cuts have serious implications for the health of remote communities, such as in the Kimberley and the Pilbara, where planned health assessments with a particular focus on detecting undiagnosed diabetes are in doubt. In addition, services such as the Broome Healthy Early Learning Program, which provides support for families with preschool children, are also in jeopardy. So these anticipated cuts are both nonsensical and bad policy, particularly as we await the Prime Minister's task force into ICE, particularly as we have the Royal Commission into Child Sexual Abuse, which makes a very clear link between mental health, AOD and trauma. And indeed, and we are seeing more PTSD amongst our defence personnel. The lack of certainty The rolling contracts from one year to the next is a disaster. Services cannot plan and services cannot react. But in my view, whilst this debate is about the anticipated cuts to the flexible funding, it is actually much more. This debate offers a window into our nation's psyche. What is going on when a nation does not fully support people who, for many reasons, find themselves debilitated by alcohol and drug issues? And why would we not support them when it costs the nation so much more if we don't? I've sat around a cabinet table. I've been involved in debates, and I know what it's like to deliberate over decisions about limited resources. And I've listened to arguments that I've put myself to seek additional slice of that financial cake. But what I'm saying today is that the toll will be too great on our communities and our families and our services if we don't increase the effort towards alcohol and drugs and mental health. So what is it that we do need? Well, in conclusion, what I want to say is this: that what we need is an authentic, evidence-framed policy which is underpinned by leadership from the top and commitment to those in need. We need a well-funded response to support such a policy. We need prevention programs that work to reduce the stigma and actually that work. We need the release of the reviews and reports into funding and service delivery so that they can inform the debate that we have to have. We need a fully funded, inclusive response to meth or ICE, supporting more therapeutic options and supporting families as well as other services. And of course, as we're all saying, we need a withdrawal of the threat to cut $800 million from our service delivery. So thank you very much for listening, and I look forward to your questions. Thank you.
Well, thank you to each of our panellists for their contributions. I might start by asking the first question before we move to some of our media members. Can I pick up from the point that you were making in the last part of your presentation, Sheila, about discussions around cabinet tables in times of fiscal constraint and very difficult decisions needing to be made there? What makes this area of policy stand out from others that, many other advocates in other causes would argue are just as worthy in your mind? And what are your hopes or predictions about what might be in the shape of the next federal budget, given we've had a significant change in the composition of the Expenditure Review Committee, the Cabinet, and indeed in the Prime Minister?
Well, all my portfolios when I was a minister were spending portfolios. And so I'd often have a big debate with the Treasurer, sometimes not terribly nice, even though he himself was a very nice one, of course, that you're all wanting to spend the money and we don't have it. Well, what I learned is that we actually do have it, and we can find money. So, yes, I acknowledge that all governments work within finite resources, but we can always find money. Now, to answer your specific question, why this? Alcohol and drugs have a significant impact throughout our nation. It's not quite, I'm really delighted in the mental health area that finally we're talking about mental health. We don't talk about drug and alcohol in the same way, and we need to understand it better because it affects families. Families don't talk about it, they feel shamed, they don't want their families to know, but it wreaks havoc, both in health terms, in justice terms, and it destroys families. If we are serious about having, as Malcolm Turnbull said yesterday, a world-class welfare system, and I put this in that space, then we need to commit.
Mark Metherell from the Consumers Health Forum of Australia. Yesterday, as it happens, the Consumers Health Forum published the latest issue of its journal, which focused on preventive health. The overwhelming view of the many national authorities we had who wrote for that issue was that we need a preventive health policy that is going to be comprehensive, that is going to acknowledge that you can't just deal with preventive health things in a one-off matter by entrusting individuals will try and stop eating fatty foods or whatever. You need an overall approach that requires national government, national organisations backing, that is going to set an environment that encourages people to have a healthy lifestyle. Very scientific, and I wonder, do you think now with the change of leadership in the national government, some are saying it's going to take a more science-based approach? Are you hopeful, you've been in government, that we may see a more enlightened view towards preventive health policy?
About 70% of children are in care because of drugs or alcohol. We know the prison systems are burdened heavily with people who have severe ICE issues. And we know that there's about $16 billion cost to our community every year, direct costs from alcohol. They're pretty stark and unsubtle, pretty clear messages that if you invest, then in the medium to long term, you are going to have a social return on investment in those major areas, and they're just 3 examples. But it takes time, it takes investment, and it takes good policy to actually make a difference.